for sure, South Carolina. But there are a lot of hospitals. I come out of a provider background. I started as a clinical social worker. I've moved my way through management jobs and working with technology over the years, and finally got a PMP 3 years ago because my current job requires it. But we would really want to expand our healthcare base, and so it's timely. We're going to talk about the Affordable Health Care Act and how that's going to touch on all of our lives in healthcare. And so welcome back, Josephine.
Thank you. So now I have my laptop right in front of me. I have my clicker, and I have a lapel mic. And just for the Sunday school teacher in me, there is a flip chart. So I'll try not to get too busy with using everything at once because I'll probably get confused. But this session is regarding the healthcare reform bill. And the Affordable Care Act is one of the most far-reaching pieces of legislation, and I could probably talk to you about my personal views on it and my professional views about it ad nauseum, and I've probably nauseated some people in the past but when I started on it, primarily my family members. But I think that it's an interesting project because an interesting piece of legislation because it does point to the way that our government approaches certain things and the way that it affects the way that we do our business. There's another handout here, presentation on federal government reform, and it refers to Dodd-Frank, which is another far-reaching piece of legislation, and it reforms the financial industry in the way that the Affordable Care Act affects the healthcare industry. And if you look on the horizon, there are a couple of other bills that are out there. The immigration reform bill will probably have sweeping impact as well. Maybe not touch all of our lives, but in ways that there's a segment of our population where it's going to have a huge impact on the way that people do business. So this presentation, if you think about the intricacies of healthcare reform, then and apply it to other types of legislation or other types of, I call them tectonic shifts in the way that our government approaches particular topics, then you can see the way that project management is absolutely critical in order to being successful in implementing and achieving the goals of sometimes of controversial and far-reaching legislation. So today we're going to focus on, and I don't have as many zips and things because I'm able to move around a little bit more, so you won't be able to focus on the slides, so I ask you, please be patient with me. We're going to focus on an overview of the Affordable Care Act market reforms. It's 927 pages of text, so we're not going to go over the entire bill. Applause. Implementation milestones in implementing the market reforms, understanding the scope of the changes, opportunities for project managers, and roadblocks and challenges. And when I see roadblocks and challenges, then I see project management. So, because whenever there's a problem, project management is the solution, right? Yes, yes, okay. So, PACA and HCERA. We've called it lots of different things. There are two pieces of legislation, the Patient Protection and Affordable Care Act, which is called PACA, ACA, or as the government calls it now, the Affordable Care Act, and most of us have pretty much accepted that. It was passed March 23rd, 2010, and then the Healthcare and Education Reconciliation Act, HCERA, was passed on March 30th, 2010, and it kind of amended portions of the healthcare reform bill. It was that if you were, what did they call those, a policy wonk, a political wonk, then you know that there were some bizarre little legislative sleight of hand things that got that bill passed, and that those two pieces of legislation passed a week within each other. They did it. And the only reason I mention it is because one of the bizarre things that happened when they modified it, if you look carefully within the bill, one of the things that it modified was the Public Health Service Act, and they dropped things, or else they used certain sections twice. So there'd be 2719 and then there's another 2719, and then another section in the HSARA, then they dropped 2719 entirely and renumbered it 2716, but there's already a 2716. But there's, it just makes, you can tell that this was done in a rush. And some people were twisting arms because they never got a chance to go back and have the staff fix it. But it consists of 10 titles, 10 sections. Title I addresses the private market of insurance, no matter who it's paid for by, whether it's your employer, you individually, and I consider state employees, state and local government employees also part of the private market for insurance. Public programs such as Medicare and Medicaid. There are some revenue provisions. The IRS is addressed in Title IX, and there are lots of tax provisions that have gotten lots of attention in the private marketplace. Title X, those are all of the HSARA amendments and all of the bizarre move this here, move that there. And then Titles 3 through 8 have some other things about quality access, the workforce, increasing the healthcare workforce, and enforcement. I have not read the entire bill, but I'm pretty familiar with Titles 1 and 2, unfortunately. The private market reforms, those are the things that we hear about. Those are the things that you've been hearing about in the media, the individual mandate and, all these the exchanges, all of those things come in Title I under the private market reform. There are consumer protections, like the appeal of benefit denials. How many of you have private health insurance? Raise your hand if you have private health insurance. If you're covered by a health insurance policy. Okay, you have health insurance. And you get your explanation of benefits, and it says, the provider billed this much, we allowed this much, this is how much you owe, and this is how much we paid. And it never adds up quite right. And then you're never quite sure why. Why did this happen? This bill, one of the most sweeping changes was the appeal of benefit denials and all of the information that is required to be given to you in a benefit denial. Initially, they required you to have, they include diagnosis and procedure codes and specific information about what the medical reason was for if it's a medical necessity denial, particularly why this isn't covered under your plan. I spent about 4 months working on a memo. That's sad. On a memo about the appeal of benefit denials because it changed the way the insurance companies did it. And it looks so small when they put it on if you go to the healthcare.gov website, and that's a web address that's very useful to have, healthcare.gov, then it just lists appeal of benefit denials. And it seems so small, but it was huge. And I'll talk a little bit more about that in a minute. Rescission of benefits. You've heard the stories about people who bought insurance and then they found out later on that the insurance company decided, well, we never should have given you coverage. Here's your money back, and we're going to take back all the money that we paid on your claims. And that caused a lot of controversy. And the uniform coverage information. So those are consumer protections. There were also enhanced benefits. And preventive health benefits. The one that's gotten the most attention has been with respect to reproductive health services for women, but it includes immunizations and health screenings for children and all of the things that, the mammograms for women and colonoscopies and blood sugar testing, all the lipid things that you're supposed to check for your cholesterol, the yearly visit that you get for preventive health, then those are the types of things that are covered under the preventive health benefits. The interesting thing is that the preventive health benefits there's no set law that says what these are. A government agency approves a list that's given by another agency, and then the insurance companies or employers have to incorporate those benefits into their plan. So again, it looks fairly simple, but when you think about all of that goes into that. Emergency room treatment, if you have an emergency and you go to your doctor, you go to the emergency room, then they have to cover it. And the phase out of annual and lifetime benefits. Remember when those McDonald's, they called them the McDonald's plans, where people had insurance, but the annual limit was $1,000. That's a couple of doctor's visits, or else you get maybe 5 inpatient days, and then, so it's essentially almost no coverage at all. So those annual and lifetime limits are being phased out. Enhanced access, allowing children to choose pediatricians and women to choose OBGYNs as their primary care physician, or getting access to those doctors as they need them. And something near and dear to people of my age group, the coverage of adult children on my health insurance policy. I would like to think that no child at the age of 25 would need health insurance through me, but I have a 23-year-old son who's still in college, and he's covered under my insurance. So those are some of the private market reforms. One interesting thing about the private market reforms, these things help people who already have coverage. So if you're already insured, these provide some benefit to you. These reforms, actually health insurance exchanges, these help people who didn't have insurance before, or who may have been priced out of the marketplace. So you've got health insurance exchanges, either federally run or state run if the states, for states that decide to run their own, but each state will have a health insurance exchange which will handle eligibility, enrollment, premiums, and billing for insurance, and there will be coverage on the exchanges for individuals and small businesses. Additional health insurance regulations for insurance companies, review of premium rates for unreasonable rate increases, and minimum medical spending, so that if they don't spend a certain, I think it's for a small business, 80% of the premium dollar has to be spent on medical services, medical costs, and 85% for large businesses. And then there are the Medicaid reforms, which include the Medicaid expansion, which is getting I don't know if is it getting much press in South Carolina, the Medicaid expansion? Is anyone talking about it much? I know for someone who's a member of all kinds of health care professional associations, that is on the top of the list of the American Health Lawyers Daily Briefing as to status in each state on whether they've selected to expand Medicaid. And then there are medical homes and community-based services also under Medicaid. And these are care delivery systems that will be provided under Medicaid once the bill goes fully into effect. Now, the implementation milestones, I call this the front loading of the bill. We have the middle class goodies that were implemented in 2010, the pre-existing condition insurance plan, retiree reinsurance, and then all the coverage to age 26, insurance appeals, preventive benefits. There were a lot of things that took effect on September 23rd, 2010, which were for people who already had coverage. So that's why I call it front-loading the bill. So those are kind of the things that insurance companies, costs that they were incurring way up front. In 2011, then the minimum medical loss ratio, or the minimum health care spending requirements, went into effect. And at some point last year, I believe that some people actually most people who had individual coverage got checks back from their insurance companies because they didn't meet those medical spending requirements. So if whatever they missed it by, then they had to submit refunds. So I think there were like $6 billion in refunds sent back to either consumers or to employers who paid premiums under this provision of the bill. And then there are the uniform coverage summaries also went into effect, which requires that all of the key information about your insurance plan, instead of getting a one-pager that gives you a few dollars and numbers, and then you get this brochure that's about 60 pages thick, there's this 8-page brochure that has to follow the federal requirements about what it says. So that's the uniform coverage summaries. In 2013, the flexible spending account limits, state decisions on healthcare exchanges, enrollment in healthcare insurance exchanges, that's going to happen in October of this year. People are going to be able to enroll in healthcare in the exchanges starting in October of this year. And in 2014, the exchanges are fully implemented on January 1st. There will be no insurance underwriting, no medical underwriting for insurance. So people who have medical conditions, your coverage used to be dependent upon how healthy you were. Well, that's now a thing of the past. They will not be able to underwrite and your premiums will not be based upon whether you are a healthy individual. Your rates will be the same as a very sick person or a well person. Guaranteed issue and renewal of coverage. They won't be able to say you can't get coverage. Anybody who applies will be able to get it, and once you have it, you have to be able to renew it. And there will be standard benefits and coverages for individuals and small business. The standard benefits, the essential health benefits, there are specific benefits that have to be covered, and there are 9 different categories. And for these benefits, then they have to meet specific actuarial requirements. There will not be any coverage where someone has to pay, the insurance will only pay 50%, and then I pay 50% out of pocket. Those will be a thing of the past. And then there are going to be a lot of additional health insurance plan options throughout in the states. Insurance co-ops, which are consumer-driven and operated by nonprofits. The multi-state plan, which is going to be something that's available in every single state. The complexity of it is it's overwhelmingly complex, and it's breathtaking in its scope. And unless for a lot of people, you really won't notice it. Hopefully. How many of you have noticed anything different about your health insurance over the last? What have you noticed that's different? That's a great, yes. Anybody else notice anything in the last couple of years about their insurance? Anything that's changed? Your flexible spending amounts went down. That was one of the things, because that's a revenue getter. That was part of Title IX, because the higher the tax breaks, then the less money comes into Treasury. So they had to change those. Another thing that changed about flexible spending, your medical spending accounts, then you can't claim over-the-counter drugs anymore. It has to be a prescription. Okay, probably saw that. So there are 3 different statutes primarily that were affected. One is the Public Health Services Act, which governs private insurance companies and state and local government plans. The Employee Retirement Income Security Act, ERISA, which covers employer-sponsored coverage, and then the Internal Revenue Service, employer-sponsored coverage in private insurance companies. And each one of these, so HHS controls the Public Health Services Act. The Department of Labor controls the Retirement Income Security Act, and the Internal Revenue Code is managing the IRS is managing the Internal Revenue Code. So each of these agencies, when they issue a regulation, then it comes out, almost all of them come out from each agency. And it takes a long time to get these regulations issued. And they're still issuing them, and many of them are in interim form. So you've got 3 different agencies. Yes, sir?
Question. You label each of these as acts. Is this all part of that large bill that was passed from that Christmas Day a couple of years ago? Is that part of what's been labeled Obamacare?
Obamacare was actually passed in March of 2010, and it amended and this should have been Internal Revenue Code, but it amended these 3 statutes, as well as a couple of other small ones. But these are where the changes are. So it added, entire sections. I think they added 3 or 4 different sections to the Public Health Services Act, and it incorporated the changes in the PHSA into the ERISA statute, which governs employer plans, and the IRS plan it incorporates, and it added some other things to the IRS. And feel free to interrupt me at any time with questions. This is pretty dense, and for most of you, this may not make much difference in your everyday lives. I understand that, but I wanted to give you some idea of what is involved and the bureaucracy, what the bureaucracy is doing in Washington and in Baltimore. And they are busy writing regulations. And they are writing regulations and answering questions and writing more regulations and answering questions. And for insurance companies, then my clients, and my clients were Blue Cross plans, then they had teams of people. They had 2 or 3 lawyers, for most of the plans, they had 2 or 3 lawyers who were working full-time on implementing healthcare reform. Then they'd have on the clinical side, and then they'd have the actuaries in the actuarial department, because there will be no more underwriting. So get rid of the actuaries, those people who make their living by deciding how much you should pay in premium based upon the fact that you had a heart attack or that you had a mole removed 10 years ago. Those people will lose their jobs. Standard benefits for individuals and small business coverage, those folks who were designing coverage, designing what the plan should look like and how much whether you get this and whether you get that, I don't think you'll need as many people because the standard benefits are there. You'll be able to tinker around the edges, but the hard work has already been set out by the government. They've got regulations on how you're going to do that. Yes, ma'am.
Yeah, just clarification on the first bullet point. So no medical underwriting on any kind of plan, whether it's individual, whether it's group, whether it's through an exchange, just no more medical underwriting?
No more medical underwriting. It will be anybody who wants to get health insurance will be able to buy coverage. Yes.
So when you're referring to the standard benefits for individual small business coverage, that's linked to some of the group plans where companies may not provide assistance with the coverage of the premiums, but instead, because of the group size, you get a discounted rate or the level of coverage that you get based on
What will be in your plan? So any benefit plan, there are 9 different categories of coverage. Medical benefits, you'll have medical office visits, hospital care, mental health benefits, substance abuse benefits, pediatric dental, pediatric vision, pharmaceutical care, and rehabilitation and habilitative care. I think those are the 9. There may be 10, but okay, let's pretend they're 9. So there's nobody in who knows any differently. Okay. I can't remember the 10th, but it says that these benefits, so you will no longer have a health insurance plan. You cannot write a health insurance plan that does not have these things if you're in the individual and small business market. So, and these plans, they can have, the benefits can be very rich so that 90% of the expected costs are paid by the employer. Or you can have, that's the most generous, I think they call that the platinum plan. And then at the very low end, 60% of the expected costs will be paid by the employer, and that's called the bronze plan. Most plans will fall someplace in between, but those plans where people were paying, were those less generous plans, where we're going to pay this much and the rest is up to you no matter how much it costs, those will be a thing of the past. Yes.
Is that like reduced, or is that limited where everybody in a company is supposed to have the same plan that would be penalized if they provided, platinum plans to the chief executive and nobody else?
Well, that's a very interesting question. Theoretically, for self-insured employers, and almost all very large companies are self-insured, which means they don't buy coverage for their employees. They actually they set it up so that it looks like regular insurance, but the money comes out of their pocket or out of a trust that they set up. For self-insured employers, that non-discrimination, so that you couldn't have these top-heavy health insurance plans, that's been in place for at least 10 years, maybe 20, I can't remember. That's not my area, specific area of law, but they never quite figured out how to implement it, so it hasn't gone into effect. So you're not supposed to do it, but the IRS hasn't really written regulations or guidance on how they enforce it. And without enforcement, then there's no real idea about what you're supposed to do. So theoretically, yes. What the statute does, however, is to say that the same way that large self-insured businesses are not able to have these top-heavy health insurance plans, then it also now applies to insured plans, people who buy health insurance. So the smaller businesses that buy coverage, and they might buy a cheap plan for their line workers and a really expensive plan for their executives. The IRS has not yet issued those regulations, but they're expected fairly soon. So there might be some changes there, but there are some guidelines about how it's supposed to work, and there's guidance on the IRS website. If you really are interested, I can point you in that direction. Okay. I looked at it once and I didn't quite understand it, and I thought, you know what, I've got tax lawyers on the other side of the building, and they'll tell me whatever I need to know. There are minimum standards for spending on medical care with rebates to consumers. I cannot tell you how much effort people are putting into to figure out how they're categorizing dollars and how they can cut spending in some areas in order to increase spending in the other. And one of the biggest ones is on the brokers, insurance brokers. They have cut compensation to insurance brokers. There are a lot of people who think that the insurance brokers who sell individual and small business health insurance will go out of business come January 14th. There would be no need for them, because why would you pay an insurance broker or use an insurance broker when you can just go to the exchange? And why would an insurance company pay commissions to insurance brokers when that doesn't count for their medical loss ratio, and they might end up having to write more checks? So the financial end of it continues to evolve. The preventive health benefits based on the federal guidelines, I discussed that earlier. The increased information requirements for consumers, that continues to evolve, and enhanced consumer due process requirements, so that when you get an appeal, then you are able to, you have the right to go to an external appeal now. If you don't like the process, the decision that your insurance company makes or your employer makes, then you have the right to go to an outside entity that will make a decision. And if you don't like that decision, in some cases, you can go to court. Small employers, huge changes for small employers. The essential health benefits, as I said, that there will be specific coverage that can be purchased. There's the community rating, larger community rating. So instead of based upon, I think in some areas, then the small businesses are rated by the other individuals in their specific area, maybe by zip code or other things, and the health of that small population determines what their rates are going to be. Under healthcare reform, those areas are going to be much larger, so their rates are probably going to come down. So it's probably going to affect the rates that small employers will pay. The access to health insurance exchanges, as I said, bypassing the insurance brokers altogether. Tax credits for very small businesses, and the requirement to pay certain taxes if they're on their premiums and things of that nature. So there's some changes for small businesses. Large businesses, pay or play. You've heard about the pay or play. This is the penalty if your employer doesn't offer health insurance. If they're a certain size and you show up and you go and get insurance on the exchange, then your employer has to pay a penalty. Automatic enrollment for very large employers. Instead of giving you an opportunity to enroll, they will enroll you in a particular plan, and you will have to take the step to disenroll. And then benefit and access requirements. Again, those are, who will get benefits, how long you can make people wait, so those are the things that will affect large employers. My employer is considered a large employer. I work for Howard University, and I can't remember the number of employees, but it certainly is more than 50. It's probably like 2,500, maybe 3,000, and we're self-insured. One of the things that the healthcare reform bill allows is that you can, or the healthcare reform bill encourages, is for employers to implement wellness programs. How many of you have wellness programs at your work, at your job? So that if you do certain things, then you get a certain prize. So it may be if you enroll in the exercise program, you get something. Or if you do a healthcare assessment, you get something. Well, they just implemented this year that if you go through a health assessment, do the online health assessment, and get a physical with your doctor, and answer some questions on the internet, then you will be able to maintain the premiums that you pay at last year's rates. Well, I work for a company that has a hospital, a medical school, but they don't think insurance. They think healthcare delivery. They don't think in terms of healthcare as an employer. So they didn't roll it out. They didn't notify people it was coming. They didn't give enough information. They had one health fair where the assessments were available. The information that they had was sketchy at best. The lawyers in our office were all up in arms, and these are, they're not, no healthcare lawyers. I think I'm the only healthcare lawyer that's familiar with the statute and familiar with employee benefits. And I don't think that the HR department consulted anyone before they rolled it out. But the complexity of even such a small thing, you have to have education, and you have to tell people what they're doing, and you have to give them ample opportunity to enroll. You have to assure them that this is legal, because a lot of people said it wasn't, and they're done, if I'm going to sue, because I'm in DC and everybody says, I'm going to sue. So, the scope of the changes, it was tremendous, just this little small thing. Imagine what it's going to be next year when there are even more requirements. The state governments are also hugely affected. And this is just regarding the exchanges, whether they're going to run or participate in the federal exchanges or let the federal government come in and run theirs. Medicaid expansion, the regulation of the insurance market, all of these, the provisions for private insurance companies, then those are enforced at the state level. State is the first line of enforcement. If they don't enforce, then the federal government will enforce. But the state is the first line for insurance companies. And of course, they still have to implement all of these coverage reforms for state employees. A lot of times, then when the federal government regulates, then they exempt state and local employees. This statute does not exempt state and local employees. So the benefits are the same across the board. Yes, sir.
Any sense of how many people will have to sign up through the exchanges for this program to work?
No one knows. I don't think anyone knows. And if anyone really has an idea, I think it'd be smart for them not to say. Because, if you try to quantify how many people you need, even if you hit a low number, if you hit a low number and you get a whole lot more, then you're not prepared. And if you pick a high number or even a low number and you don't get that many, then it's a huge failure. And everyone's kind of walking around in the dark right now. That's my impression.
Well, from a financial standpoint, you don't have a rolling number. You're just going through some steps.
People are going to enroll. I don't think that, and it all depends on how well each state does as far as promoting the insurance exchanges, so that people understand what they're all about. But it's how many insurance companies are going to participate as qualified health plans. Nobody really knows any of this stuff. I'm sure that the big insurance companies that exist now, my impression is that they feel as if they don't offer something on the exchange, then they are going to be losing the opportunity for a market. And they're going to be losing market share to those who do offer it. But whether there will be, what kinds of plans will be offered on the exchange, it's still kind of up in the air. And the other interesting thing about the entire process is the government talks to insurance companies. And when I say the government, then I'm not speaking as the agency, but there are conversations between the regulators and insurance plans and industry groups all the time. The comment process, the conference calls and webinars, and they have lots of conversations, and they're getting input about what people are doing. And there are also some fairly high-level discussions where high-level people from large insurance plans, the Uniteds and Aetnas and Blue Cross plans, then they do have conversations either directly or through their representatives with the government. So it's not as if everyone's working in a vacuum, but the question is, when you decide that you're going to wipe the slate clean, and it's not actually wiping the slate clean, it's kind of when you're going to shake up the board so much and implement something different. It's not like you're putting it on top of. You're eliminating some things and making new things. What's the effect going to be? And it's hard to tell. It's really hard to tell. So the stakes are really, really high.
I got a question. No disrespect to lawyers, but let me ask you this. One of the problems with healthcare has always been the malpractice and all that, and suing and all that, since you brought up suing.
how come they didn't address any of that for this bill? Was the bill just to provide insurance, but they didn't really want it to reform it? Do you know anything about that since you're there?
Um, Actually, I spoke on healthcare reform last week with a doctor she was an OBGYN for 30 years, and she said that her insurance premiums were $1 million a year by the time she finished practicing. And, you know, obstetrics, then, you know, there are bad results all the time, and people sue. I believe that there is one very small piece in the legislation about malpractice, and there's a study, some kind of study or commission or something, but it doesn't really do anything at all. But I think that that's because there's not real consensus on what causes those malpractice costs to be so high. And I'll give you a small anecdote. There was a story about on NPR, a program, about why the cost of medicine is so high and what defensive medicine really means. And there was an ER doctor who treated a young lady who hurt her ankle playing soccer. And he looked at her ankle, and he examined it, and he x-rayed it and said, okay, it's a sprained ankle, and here's what you do. And her father said, shouldn't you do a CAT scan? He said, well, no, she got a sprained ankle. And this is the problem, there's the x-ray, and he showed her the x-ray. Well, I think you should do a CAT scan. And so he explained again, number one, because, you know, a CAT scan is not, it's not a benign thing. You're putting radiation into someone's body, and it's unnecessary. And I've got other things to do right now besides looking at a CAT scan, and it's going to cost somebody some money. But her father demanded the CAT scan, and he made a big stink, so he did the CAT scan. And he said, standing up to the father and saying, I am not going to order this CAT scan, would have taken much more effort than he had to give. So he did the CAT scan. So, you know, we demand lots of services, and we demand perfection as a society. And that's reflected in lawsuits. And it's not just malpractice lawsuits, it's also the slip and falls and the product liability. I mean, the reason why your hairdryer has a label on it, and I'm sorry, I'm on a soapbox. Soapbox warning, soapbox warning. The reason why your hairdryer has a label on it that says do not use in the bathtub, somebody used that thing in the bathtub. I mean, I think the best thing as far as malpractice and all of our tort liability would just be common sense. Bam, bam, don't do that anymore. But, okay, so down from my soapbox. No, the statute does not really address the issue of the costs added to the healthcare system by malpractice. But one of the things that if you look at it, the cost of our healthcare costs, somebody is paying for every bit of healthcare that's delivered by doctors and hospitals. So if you have no insurance and you go to the emergency room, you're paying more there than you would if you went to your doctor. So if you don't have any insurance and you went to the emergency room, the hospital somebody has to pay for that. So everybody else who has insurance is paying. Or else, heaven forbid, if you don't have insurance and you get the bill and you actually have to write a check. Because just as your insurance company, my insurance company pays $57 for an office visit that costs $125. But I imagine when my son, who's 32, goes and he has no insurance, then he has to write a check for $132. That's something's wrong with that. So somebody's always paying. It's just a matter of cost shifting and who's going to be paying the fees. So it's the aim of the statute is to make sure that you get as many people with coverage as possible so that you can get care at the lowest possible level. Okay, that's yes, President Obama, I said it. That's the goal. And apparently something happened here. So it's project management opportunities. There are a couple things that happen with project management that really give opportunities for project management. Number one is extensive modifications to information systems. So let me just use these denial letters as an example. So a claim comes in, and it's for $125. and the insurance company pays $57. And it not paid, because they stopped saying denied a long time ago, right? We don't say denied. That's a bad word in insurance. And I worked for an insurance company, so I know they don't like that word. So it's at 68. Not paid 68. So is this a denial? How many think that this is a denial? So according to your plan, I will pay, this is the amount I pay based upon the physician's schedule. This is a contracted provider, I pay $57. Is that a denial of care, a denial of benefits? Raise your hand if you say no. Raise your hand if you think yes. You are all wrong. According to the government, this is a denial. If you have not paid what the claim said, then you have denied $68. How many of you are going to appeal if you don't have to pay this amount? Okay, so let's say that they said they pay $57, and your co-payment is $25, and you thought your co-payment was $10. Is it a denial now? Still not a denial? You think that you should have paid, your co-payment should be, because your doctor's going to come to you for $25, and you paid only $10. Is it a denial?
Denial says you weren't allowed to file the claim, or the benefits that you're seeking isn't covered at all.
Okay, let me put it this way then.
Plus, there's a scheduled amount there, and normally, depending on what kind of insurance you have, if it's a managed care type of plan, let's say, you're not liable for the amount over the scheduled amount. You're liable for your co-insurance.
So this is your co-insurance.
Yeah.
They say 25, you say 10. Is it a denial? Is it an adverse decision? It's an adverse decision? Okay, let's use the word adverse decision. All right, so now we've established that this is now an adverse decision. Because if it's an out-of-network provider, then I'm on the hook for all $68. If it's an in-network physician, then I may be on the hook for the 15, right? So if I deny a claim, if a claim is denied, then this is not a good pen. You know, I always complain to the Sunday school superintendent about not having enough dark pens, new pens for my class. But anyway, all right, so the notice, I need to know, you want to know what? On the notice that comes along when you see these numbers, what information is important to you? Well, they already said you owe $25. So what else do you want to know? Why? How many of you were able to tell by looking at your explanation of benefits why they paid what they paid?
Well, there's little codes.
There's little codes. Okay,
Spend it out.
125. Code 125. And it would have like a couple of words there, indecipherable. And I've worked on, one of my pet projects, I'm proudest of, was we created denial letters for a plan that required you to have these long codes. So I've written those codes that say, code number 125 says, you know, your plan has a negotiated rate, this provider charged too much, blah, blah, blah. But you only have 200 characters or something like that, some small amount to go in that code. So the government said, so the statute said, you need to give people a better understanding of why their claim is denied, or else how can they appeal it, right? So now we need to know why, which is the reason. If you have a reason code, if you use a code, the reason code and a description, and then I need to know the plan provision. So if your insurance plan says that we do not pay for services that are experimental in nature, then I need to refer to the language in the plan that says that. So, how many of you ever worked on an EOB project or anything we do regarding checks? Regarding checks. Now imagine what it takes for now. So think of what has to happen first. First of all, we had to convince the lawyers that this is really what it said. I don't think they mean to do that, Josephine, because you can't put that in an EOB. Yes, they do need to do it. We talked to them, and they had a webinar. We asked them questions. This is what they do. The FAQs say you have to do it this. We got through all of this, and then they said, all right, so this is what it has to say. But we don't have room on the EOB, the explanation of benefit. Sorry, you still have to do it. So you get the lawyers convinced, and then they go to the the clinical operations people, and they say, you have to explain to them. Oh, no, we can't possibly do that. Our nurses don't have time. We don't have time to put that information in. Okay, so now you go to and then you go to claims processors. I'm sorry, we don't have time to do that. How would we do it? So now imagine the project team inside. The lawyers, the compliance people, and then you have, who else is going to be on that project? The clinical operations folks, because they're the ones who are making medical necessity decisions, in the case of medical necessities. And then you have just the regular claims people who are just applying benefits, applying the rules to the claims. And you have the claims processors. And then you have the IT people and the data people, all trying to figure this stuff out. And the ticker is going ka-ching, 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 because every time you reach a certain point, someone's going to dig in their heels and say, we can't, if I have to do this, it is not programmed. Our system does not allow more than these number of characters. So go back to the lawyers and say that we need to do it a different way. So then they call me, and it goes ka-ching, 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 ka-ching. Heaven forbid that somebody says, let's not do it anyway. I don't want to do it. So implementing this, the extensive modifications to information system. It's supposed to be flying in, but apparently I was too sleepy when I was doing this. So the modifications to the information systems infrastructure and the capacity concerns. Complex multidisciplinary implementation. This just screams project management, doesn't it? This is what you do. This is what you do. Regulatory delays and modifications. How many times did they publish regulations about this? They published in June of 2010. That's the one I spent the first 3.5 months on. My memo was 72 pages long. And then they came out with FAQs. This is a reg. Frequently asked questions, which in some ways seem to contradict what they'd said here, but okay. They came out with version 1, version 2, version 3. Because the regulation was so confusing or ambiguous that they needed to come up with more guidance here. And then they figured out, oh, external review. There aren't enough, so it's external reviewers, when you finish at your insurance company and they still say no, then you can go and get an independent review. There aren't enough accredited external review organizations. There aren't enough doctors out there to do these reviews on the external. So then they have to come out with provisional plan. We're still in 2010. And then they modified this, and they issued some more FAQs. And then they modified the provisional, and this was issued as an interim final regulation. An interim final regulation, which means that under normal regulatory process, then they'll issue proposed regulations, get all the comments, they'll review the comments. It may take them 3 months, it may take them 3 years, but eventually spit out a final regulation, and then when it becomes final, then that's when you follow it. This one, interim final, means that we're in such a hurry, this stuff goes into effect in a couple of months, so This is the interim final stuff. You got to follow this. So you can imagine what this process of, and it does, if it looks a little confusing, add about 3 or 4 different sets of guidance to this, plus the stuff they were saying on the webinars. Regulatory delays and modifications. Remember I talked about those non-discriminatory provisions that they're still waiting to implement something that happened years ago? And yet they had to start issuing letters on September 23rd of 2010. And they've been issuing letters, and every time something changes, then we may have to make change. What does it do to our information systems and our training and our education to our members and our brokers and our clients? An uncertain market impact. Who knows what's going to happen in 2014? Is everyone going to go for these exchanges? Yay, I can go and buy insurance on the exchange, except for a young person, it's going to cost them about twice as much as it did before, because young people have no health, generally speaking, have fewer health problems than older people. So their insurance premiums were much lower because I could charge the older people more money based upon the expectation that they would cost more. Once that's done, then younger people, they don't know whether young people are going to buy insurance at all, whether they will have fewer people buying insurance. Although with the exchanges, then it's likely that they will buy insurance because their mothers will make them. Even if I have to pay for it myself, you're going to buy insurance. Shifting federal and state collaborations, and I tried to find a nice word for this relationship between the states and the federal government. Collaboration, sometimes friendly, sometimes not so friendly, sometimes genial, sometimes more contentious. But who's going to run the exchanges? I'm not going to, the whole process. California was up and running with their plan within 6 months. They'd already passed all this legislation. They were gung-ho. New York took them a little longer. Virginia still hasn't really kind of figured out what they're going to do. On the Medicaid expansion, the same thing. Are they going to expand or not? It may not make much difference to us, those of us who have insurance, not directly, except that for every person who gets unpaid care, it causes our insurance costs to go up, and eventually that comes out of our own hide. Infrastructure capacity concerns. That is how is the federal government and these states, how are they going to put together this process so that information can flow? And this is I can do another picture. How much time do I have? Anybody looking at time? Okay, well, I'll try not to talk for 40 minutes, although I can. All right, so when you go to the exchange in order to enroll, so I do my application. The application is here, and then someone's going to run an eligibility check. The first one is going to check to see whether I qualify for any public programs. And that might be, the primary one is Medicaid, but it may also be the CHIP program or some other program for women with children, pregnant women. So any kind of public program, if I qualify for that, then they're going to shoot me over to that agency. That's a yes. So then and this is online. And then if the answer is no, then they're going to do an eligibility for the exchange. And there is a process to determine whether I'm eligible for the exchange. For instance, I can't be eligible for my employer's coverage if the employer's coverage is affordable. So what is affordable coverage? Affordable employer coverage? You just yell out if you guys have the formal answer to that. Affordable insurance coverage, according to the statute, is insurance where the premiums do not cost you, or the out-of-pocket expenses, premiums plus copays, do not cost you more than a certain percentage of your household income. Well, how does your employer know whether you have household income that exceeds a certain amount? How will they know how much money your household makes? It's a conundrum. So they figured out that what Congress really meant by household income is your income. That's one of those. It's a convenient fiction. What you meant to say was individual income and not household, because your employer has no way of telling. Otherwise, he would be able to set the premiums differently, and everybody's going to have something different. So they had to come up with some way of telling, and they can't even, so if you have affordable coverage through your employer, then the answer is no. Go enroll they send you to your employer. If you don't have, then you can go and then you enroll. So once you enroll, then they have to determine, gee, are you eligible for subsidies? That's the advanced payment of the tax credit. Because if you make a certain amount and then they're going to give you tax credit so you can buy coverage on the exchange. Yes, ma'am.
So is the application process only at the individual level, or is there, so does every member of the family have to apply, or does it?
No, you can apply for your family.
Okay, but you're only going to have, what if you're a two-income family?
You're only going to apply for your family. I don't know. But I got a call from, I started at Howard in February, and I knew that I was going to get the job in late January. And there were things coming out about the application process and some other things that had kind of been up in the air. And I have to admit to you that I started looking at what hospitals and academic medical centers are caring about in the industry now, and I stopped paying too much attention to what insurance companies need to worry about for the exchange, for the healthcare reform. And that was just self-preservation. I couldn't do both. Okay, so there's the advanced payment of tax credit. So they have to do this. So there's information that goes to the IRS. And then there's the co-pay subsidies. So they check to see, are you eligible for this? Are you eligible for this? If you are, then some information goes to the IRS and back and forth. And then you select your plan. So you're set now. You've selected your plan. Okay, now we got to send information to the plan. And then we're going to figure out the premium. And apply the subsidies. And then so this is the bill. And then the bill goes to the insurance plan. And then the insurance plan sends the enrollment information to you. And all this is based upon a system that has been operating successfully it's never been done before. So you can imagine there are people who are making a ton of the advanced tax credit you got, because if you got a tax credit for your premiums, to apply to your premiums, then you can't claim that on your tax return. So the complexities of it, what does this cry out for? You know that there are a bunch of project managers running around in DC, outside of DC on those high-rise buildings around the Beltway who are working these kind of processes. And this is just on the enrollment side. On the plan side, there are certain requirements as far as what the health plans will look like. So the top 10 reasons to use project management: to control scope creep and manage change, right? Because for those people who have been sitting around waiting for an opportunity to get into the system and make a change here, while we're in there, have you ever heard this? While we're in there, why don't we just go ahead and fix this other thing at the same time? And it's like the camel with its nose under the tent. Once the camel gets his nose under the tent, then you've got the rest of the camel to worry about. So scope creep, and manage the change. So all of these processes, I can't think of another situation in which you have so many different components of an organization that are affected by a change. So many different components of an organization. Being in an insurance company right now seems like it would be a perfect place for a project manager. But certainly you have to have good project managers. And one of my Blue Cross plan clients, when I was at the firm, then he was the project manager for legal. And he was the interface to make sure that all of the different people on the project were doing the things that were required. So he was feeding the information. He knew who needed which piece of information and what he needed to follow up with them on, just on the legal side. That wasn't his, that wasn't his job title, and I don't think he was trained by it from some of the feedback that I got from other people in the legal office. But, at the same time, there's networking requirements, and you're trying to set up relationships with accountable care organizations and with primary care medical homes and all these other things we never even heard of. You have to deliver the project results on time and on budget. We don't know what this project, I think with the exchanges, this is the process that's going to be the one that is going to tell whether it's going to be successful or not. Whether on October 1st, anybody's able to enroll in anything. Whether they know that they need to enroll or not. Whether you're going to have, even the first person, if you get one person that wants to sign up, is this stuff going to work? But how do you deliver projects on time and on budget when you don't even know what your requirements are? You have to focus the project team on the solution. You have to always working toward, and identifying the solution is incredibly difficult in this environment. What is the answer that we're going to move toward? What are we going to call this thing? What's going to go in here? Because some of this is just business decisions. And one of my, I went to a conference a couple of years ago, and it was a general counsel roundtable where the purchasers of outside legal services were sitting around a table. And this one gentleman from, I think, Travelers Insurance, he said, I am not looking for the guaranteed answer from my outside counsel because it would take you too long to get to the guaranteed answer. But you've probably gotten to the 90% certainty answer within the first couple days. And then you can spend another 2 months trying to nail down the other 10%. But that sounds about right. We're pretty sure, we can be pretty sure within a very short period of time, but as you try to chase down all of the contingencies, the things that might trip you up, you can spend a lot of time chasing those things down, but you have to focus on a solution because we've got to move forward. And the deadlines are not being pushed back any. Obtain project buy-in from disparate groups. So if the legal, and I'll pick on legal because they used to bother me too, but if legal says you have to do it this way, and the claims team says you can't do it this way, and then the IT says, well, we can do anything given time, money, and resources, sure, we'll be able to do that. We can do that, absolutely. Just give us another 2 years, we'll have it ready for you. But getting project buy-in from all these disparate groups, that's something that only project managers can do that. And defining the critical path to optimally complete the project. What are the key things that need to be accomplished? And then focusing on those areas, setting the priorities. Provide a process for estimating project resources, time, and costs. How many of you track costs on your projects? Raise your hand high. I think that's just fantastic. I was never able to do that. I know that because you remember I'm not a certified project manager, so I never learned how to track costs. I could track hours. Sometimes that translates into costs, but I wasn't responsible for costs. Other people were responsible for costs. But estimating the resources and the time, it requires a level of critical thinking. On this statute, it requires a level of critical thinking that I think is it's a reach. as you're trying to manage something where everything hasn't settled down yet, and the goal is still moving. They keep moving the goalposts. Communicating project progress, risks, and changes. Again, as the changes keep coming, the risks keep coming. And one of the biggest risks on some of the people who are working on exchanges is that we don't know what the system is going to look like. So that's a huge issue on anybody who is going to be operating on the exchanges. We don't know what the end state vision is going to be. They've given some information, but and as you wait for information from the government so that you can, because they oftentimes, if they haven't issued any guidance at all, then the regulation, that they can't enforce it until they've given you, notice and an opportunity to comment and a period to implement. So it might be 60 days, it might be 90 days. But when you're still waiting for the first set of regulations to come, or else when they send out, because the first application for the exchanges, it was so long that everyone laughed at them and said, I don't think that this meets the whole 8th grade education thing that you were doing. And people will get so discouraged that they'll just stop in the middle. I was working on an enroll. I was signing on as a sponsor for an organization's annual dinner, and I got to the point where I have got something else to do. I cannot continue this application. I've just got to close it down. I mean, when you start something online and it gets so complicated, you got a gazillion things going on, and you think, I'll just get this done right now before I go home. And you realize, I could be here for a long, long time. Or else my desire to do this is gone. I don't care if it takes another 5 minutes. I don't care if it takes another 30 seconds. I'm out of here. But again, they came back with a much shorter application. They just issued it the other day. I haven't had a chance to look at that, but everyone giving them kudos. More information, shorter application, great. There's probably something missing on there, but it's a cost-benefit analysis to surface and explore project assumptions. Like this one about the denial, they can't possibly mean that this is a denial. This was an assumption that every single plan came up with the idea that this is not a denial. When they say you owe 25 and you think it's 10. When they say that we paid the doctor what he's due and you owe the rest. Nobody thought that was a denial. That's a paying according to the plan. Well, maybe I interpret the plan differently. Maybe I don't agree with your interpretation. Maybe it's unclear. Maybe I can get a lawyer and I can argue this. But when it's $125, it's not a big deal. But when it's a bone marrow transplant, the dollars, it doesn't matter whether it's $25 versus $2,500, because the principle is still the same. And if you get caught up in looking at the small dollars, then you don't understand that it's the big dollars where somebody's going to come and get you, or else just a disgruntled client who happens, or member who happens to be a lawyer. That's the worst nightmare. We did a 5-year case against someone whose child was denied certain type of services, and he was a lawyer and he represented himself. He lost, but he didn't have to pay anything, and we did, or my client did. So surfacing and exploring project assumptions, preparing for unexpected issues, document, transfer, and apply lessons learned from your projects. Because this is not the end. This statute just has too many flaws. There are too many things wrong with it, and I consider it to be the middle state vision. I don't think that the way that the system was structured, and this is Josephine Harriott's personal viewpoints, and I do not represent Howard University, the Project Management Institute, or anyone else who might not agree with me. So the system that we had was unsustainable. Something had to happen to it. And so they have this, I consider this the middle. And they will pick away at it. There's a couple of things that were in there. There was a long-term, or some type of long-term care thing. It was like a quarter of a page. It didn't even make any sense. There was never any way it could take place. It was supposed to be taken out in conference. They threw it in there because there was a senator who cared a lot about it, and they expected it to go away in conference. But since they never had conference, they couldn't take stuff out. So, that one, they did repeal that within the first 3 or 4 months. They were able to repeal that, yes.
I have a question, just because I have the opportunity, you might know. I thought I saw a blurb in the news last week or two about if you get like a pacemaker, someplace it's 70,000, if you get it somewhere else it's 110,000. Will this kind of insurance, or this kind of reform help with, it doesn't matter where you live, or does that just maybe the cost of various things, or is it have nothing to do with this?
It does have things to do with it. Remember, I think, yeah, I mentioned that Titles 3 through 8 had a bunch of other stuff in there, and cost containment and quality of care and things of that nature. Those are some of the things that are included there. There's lots of data requirement. There's a ton of reporting requirements. Another, gift that keeps on giving. And so the reporting requirements for health insurance plans is going to be tremendous. So claims information as far as how much things cost, how much you pay for things. There is not really an explanation for why something would cost more in one hospital than another. The disparities in the Washington, D.C. area are tremendous, are almost like that, almost 70,000 versus 110,000 between hospitals in the Washington, D.C. area. And they're all good hospitals. The idea is that once the Health and Human Services has more data, then they can start publishing the data as far as how much things actually cost in various places, because no one really knows how much anything costs. I mean, we have no idea how much it costs to do, how much does it really cost to do this service, as opposed to once you've loaded on all the other things, including uncompensated care. And it doesn't matter what you say it costs anyway, because everybody pays with insurance, or most people pay with insurance or Medicare, so there's the cost shifting between Medicare, and certainly Medicare does not pay for itself. So we, with the private insurance, are subsidizing Medicare payments. So I think that the idea is that with all of the data that will be reported, then they will have a better idea of how much things actually cost, and consumers and purchasers will be able to make better decisions.
So that kind of stuff shouldn't be impacted by if a doctor in Mount Sinai has a very prestigious pay versus someone maybe in Missouri who doesn't get paid as much. That stuff shouldn't come into play.
It shouldn't come into play as much as it does right now. I think it'll lessen. The idea is that the impact of the unexplained variances in price will start to disappear. That's the in-state vision.
But isn't that a good pre-competition? Well, yeah, but the doctor in Mount Sinai, he has expertise. Aren't they, allowed to, that hospital?
Allowed to charge more?
More because they had the expertise versus.
My insurance company does not pay more money to one doctor over another. They have a rate for X. They may have incentive payments. There may be, so there may come a time when there are incentive payments. Certainly Medicare is penalizing hospitals that don't meet certain quality standards. Those penalties just went into place recently. I think readmissions was one of those. So certain hospitals that have a higher readmission rate, then they've lost money, some money, while hospitals that have a lower readmission rate have gained some money. So that's a whole different discussion, but that makes me scratch my head, and if you take it, then do I be disincentivizing people or something? But anyway, so I think that there will be more changes. I don't think that anybody's going to be able to repeal Obamacare, because how many of you want your 23-year-olds to not have insurance? I mean, does anyone not want their preventive health care paid for? And we want the annual limits back. We want to have bad. So there are certain things that, and I think that's why they put those middle class, I call them the middle class goodies, up front, because those are things that it's very hard to argue that you don't want. There are more controversial things in the statute that are, some people support, a lot of people don't, and they cause lots of controversy. But it would be difficult to just repeal the whole thing because it's all so intertwined. But there will be some changes as we go forward. And as we continue those changes, then we have to recognize that complex government requirements feed the need for good project managers. And because healthcare reform is one of the gifts that keeps on giving, every time they made one of these changes, they called me back. It was great. More billable hours. Same thing with project management. Change it. Okay, we'll just change it. And so if everything goes smoothly, then project management isn't nearly as well valued. It's when, you're keeping your head. If there's not chaos someplace else, then you being able to insert some order and bring some order to the process, it's not nearly as valuable. So as much as we hate chaos, it's lucrative. The costs of noncompliance raise the stakes. There's a huge cost of noncompliance. At some point, then they're going to be enforcing. There's much more requirements. There are more requirements than there ever were, and there are more legal remedies for people who have employer-sponsored care. While the statutes have changed the enforcement mechanism, then the courts have also been changing some of the remedies that are available for people who don't like decisions that their insurance companies are making. And I'm not, this Medicaid expansion at some point, there has to be a national consensus on what we're going to do. So there are going to be haves and have-nots until then. Shifting public priorities lead to statutory and regulatory changes. There will be changes in this bill, just as there are changes expected in Dodd-Frank and some of the other big bills that pass. Because nothing is perfect at the time they pass, and if you understand that legislating is like making sausage, how many of you have seen sausage being made? I have actually helped make sausage. It is not attractive, it's very messy, but it was tasty when we finished. And in the competitive business environments, rewards agile and cost-effective implementation. If you can do it better, faster, and cheaper than your competitors, then you will come out ahead. Those that figure out how to market on the exchanges, if they're able to market their plans on the exchanges better than anyone else and they have it all together, then you can't, if I know that Blue Cross is headed in this direction, and they seem to be headed in every direction, but then there are people scrambling if they want to enter the market in South Carolina and not have Blue Cross take even more of the market share, then they're going to be scrambling to understand this market and try to do it better, or at least as good as their competitors. So, are there any questions? Any other questions? Comments? Oh, yes.
When you talk about the standard benefits, is it going to be something that, based on your knowledge, that you can kind of negotiate your premiums if you want to pay for less than standard, or is it across the board that the minimum companies must order or must, I guess, offer to other people are those standard benefits? There is no underneath where I can go higher, those different tiers you were talking about, or I can go lower depending on where I want to sit.
The lowest is the 60%, although there is this thing called a basic health plan, and a state can institute a basic health plan or catastrophic coverage, but I think you have to be real young, and there's some interesting requirements for you to do that. But the 60% is as low as the value of that plan can be. So the maximum amount that you come out with paying is 40%. The challenge for insurance companies will be, within these constraints that have been designed, how can I maneuver so that maybe I'll provide a little bit more here and a little bit less here. So I'm going to provide more generous outpatient and less generous rehab. So how do you, finesse this process so that within the constraints that there are, then the plans can be creative and you can choose something that fits your needs. Although for the most part, these are going to, and these are for small businesses. For large businesses, then I don't think much is going to change as far as the way that they manage business, except for some, that if their plans are too expensive for their employees, then they may get penalized in some way. Any other questions or comments?
Next year, 2019,
expectation that there may be less availability of professional healthcare providers?
Oh, the workforce issues as
Yes.
far as the availability of primary care physicians.
Yes.
That is a huge concern. And there are initiatives in high schools and colleges in order to recruit people to work in, to go into medical school. There are initiatives in medical schools to encourage medical students to stay in internal medicine, pediatrics, family medicine, and those specialties that can serve as primary care doctors. But that's a big concern, that there will not be enough primary care doctors for all the new people coming into the market, those folks who are getting their primary care in emergency rooms.
Is there any kind of corollary initiative going on to try and even out salaries for primary care and physicians versus some of the specialties so that they can attract more people into primary care?
I don't know whether they're trying to normalize the salaries between specialties and primary care. I suspect that as maybe if, economists will tell you that as the demand for primary care doctors goes up, then more people will choose those specialties because the compensation will go up commensurate with their demand. But, I don't know.
Could you just, since I'm not directly in the healthcare industry, explain that comment you made about firms being penalized for providing more than, for providing?
Oh, if they don't provide, if their coverage is considered unaffordable. So, for instance, there are some plans, there are some companies, large companies, that may not provide any contribution to health care. Those companies would be penalized under in 2014. They'll get an IRS penalty for every person that goes onto the exchange and gets coverage because they can't afford the local coverage. But there will be you should be getting someplace on your W-2. I don't remember whether it was on the W-2s this year, but the value of the amount that your employer pays for insurance premiums. That's out there now. And so my husband, I figured out my husband is covered under federal employees insurance, and we paid about $11,000 in premiums last year. And the government pays 70% of the premiums. So the government paid more than $11,000. If I could do the math like that, I would be in IT. So the value of the health insurance dollar is tremendous, and it's also one reason why some economists look at it differently is because they look at it critically because it's not taxed. And so the more generous if I pay you $50,000 a year in salary, and I pay $10,000 to your insurance, so you're getting $60,000 in compensation, but I only pay taxes. I don't have to pay taxes on that $10,000. But economists say that I should not be, that the companies perhaps should not be getting that tax benefit because it is a huge tax expenditure from the insurance. It makes a big difference. So there are certain categories of tax expenditures. One is the retirement savings and contributions. The other is healthcare contributions and healthcare expenses. And the other is the home mortgage deduction. So those are some of the big areas in which our government has tax credits or tax deductions going. So there are thoughts that eventually, if you have a Cadillac health care plan, then they might decide to start taxing that. But who knows if there will even, what the system is going to look like going into the future. But it's evolving. But change always means that change creates opportunity. And for even as much as we may disagree with the way that the statute was passed or the way it's being implemented or even the philosophy behind it, there are things that, people are making a lot of money on it. Private industry is making a whole lot of money on it. And in some way or the other, it's going to touch all of the things that we do. And the idea that I mentioned in my earlier presentation about being aware of your environment, then I would suggest that keeping track of state and federal legislation is a valuable way of understanding what opportunities will be coming down the pike later on. If you know what businesses are what kind of businesses you have in your area, and you know what kind of statutes are being considered, then educating yourself on that so you can be on the front end. So being able to say that, I work on healthcare reform, then all of a sudden I was nobody. Who has a third-year associate speaking any place? But all of a sudden people wanted me to speak on panels because I was working on healthcare reform, and I had the plan experience in the past, so I was able to speak with a little bit more practicality than some of the other attorneys. So it's a great opportunity for me. So cash in. Any other questions? I hope that all of you have put your cards into the fish bowl here. Has anyone not? Okay. Because we're doing drawings. Apparently, just listening to me for an hour and some odd minutes is not reward enough. You need something more. It's not a whole lot, but we do have little goodies for you. So I want you to, I'm going to have my niece, Miss Broden, pull this out. This is, you will not be able to win. And she's just learning about project management now, and she's interested in it. So I expect that she's going to walk away today with lots of cards.
No pressure.
No pressure.
Cindy Gaudet.
Cindy.
Now we will.
Kevin, I'm gonna get the Chainsaw Massacre 3D man to come get you, okay? He'll fix it. I don't know. It's up to you. I think though, if you
And also a graduate from Emory University in Atlanta. She was a project manager with AT&T, IBM, and the EMC Corporation. And in 2003, she started her own training company in Atlanta, which focuses primarily on project management, team building, and facilitation. She has spoken at many PMI conferences, including PMI-SC, France, and Italy. So we are very excited about having her with us today, and I will pass it to Dana.
Thank you very much. I appreciate it. Wow, we are here today to talk about no more slackers on your project team. How many of you have slackers on your team? Okay. How many of you are the slacker on your team? I found it's so common. Just those people who are kind of dead weight, they're not quite with the program. We really need to figure out how we're going to deal with them. The thing that I found that has been so successful, in addition to dealing with them individually, is building what I call a culture of accountability. And that's what we're going to talk about for the next hour or so. So here are our learning objectives. I really want to define it. What do I mean by a culture of accountability within the team? So I want to be sure you're really with me in terms of that. But beyond that, I'm one of these speakers that I don't necessarily believe in a whole lot of sizzle, get y'all rah-rahed up for the next hour, but then when you get back to work, you don't necessarily have any real tools and tricks and tips to actually implement. So I want to give you some real techniques that you can start using almost immediately. And then a lot of those techniques are going to deal with the entire team, because that's what we're talking about when we talk about that culture. But I also want to give you some techniques to deal with people one-on-one. okay? Because sometimes you've got a more systemic issue and you want to focus on the system, but let's face it, sometimes you've got an individual issue and you need some techniques and tips for how to deal with that as well. So with that, I think we learn not necessarily by listening to the person in front of the room, but also learning from each other, hearing the good, the bad, and the ugly. So I want to start with a real scenario, which I know when I was a project manager probably happened to me on a weekly basis, if not more. See if I'm not the only one in the room who's had this happen to them. You're in the back of the room, getting ready to start another project status meeting, and then all of a sudden, out of nowhere, you're pouring your coffee, Luke Jones comes running up to you. Dana, oh my goodness, I'm so glad I had a chance to catch up with you. It's just been so crazy. I know we're getting ready to start the meeting, but I just wanted to let you know, I know that I said I was going to get that information sent to the team for the meeting today, but I just didn't get a chance to do it. Have you heard that before? Yes, some version of that. Oh my goodness, there was a website crash fiasco. I know you heard about that. I got pulled into that, and I was having to pull late hours. So I know, I said I was going to, get you all that information by today, but just didn't get a chance to do it. So my question to you is, if you're the project manager, when you turn to Luke Jones in that moment, what do you say? Okay? So we're going to do this in a little bit of a team case scenario. I want you guys to talk about it. So this is going to be continuing the networking. I know we've been doing a lot of networking today, which is wonderful. So meet and greet the person or people sitting on either side of you. And I'd like you to get into groups of, maybe 3 to 5 and just talk about it. And what I want you to talk about and then later on share with the larger group, not what you'd want to say or what you hope you would say, but what do you really think you would say in that moment? So again, don't give me what you think is the right answer. Give me what you think you really would say in that moment. So we'll do about 5 minutes of you guys chit-chatting, and then we'll share and see what you guys have come up with. All right, and let me give you a few options before we jump into your answers. Option number 1, hey, Luke, don't worry about it. We're all running from one crisis to another. Please just get it to me as soon as you can. Option number 2, I really appreciate your letting me know, when do you think you can get it done, given your workload and everything you've got on your plate? Option number 3, I can't believe this. Why didn't you let me know about this earlier? Option 4, this is not acceptable. You need to get it to me by the end of the day. Or something else, something completely different, your own customized response to him. Okay, take about 5 minutes, talk about it, and then we'll hear from you guys. Okay. Let's see what you guys talked about. And let me just say that there is not necessarily a right answer. It's going to depend on a few different factors. I probably have, said one version of each one of these at some point in my career, so it's not necessarily that there's one right answer. But I just want to get into this discussion a little bit because I think this is a classic scenario that a lot of project managers face, or at least I'll speak for myself. It was a classic scenario that I faced where I felt like I was constantly pulled between trying to develop the team, but also trying to clamp down on people who weren't really pulling their weight and trying to deal with these sorts of situations effectively as they arose. So I'm really interested to see what you guys talked about. So, volunteer, what'd you say? Yes?
Kind of had some combination of all of this, but the thing that we added was that we would then let them know what the consequences of their actions were on the team and on themselves.
So we want to ensure that they understand, Luke, because we don't have the vendor names today, unfortunately, that's going to delay our selection process. So I do want to be sure that you understand that. So a little bit of guilt, I feel, kind of going there. We want to be sure they understand those consequences. Okay, I see people nodding. What else? Yes?
Like she said, we were a little bit off. I believe 2 was closer to where we were at, but we took it a different angle.
Okay.
Wow, Luke 1 should have communicated this earlier, but as part of being a project manager is getting status reports.
Ah.
Should we have taken some responsibility ourselves and checked in with Luke?
Okay.
See where he was at.
So maybe there's a mutual responsibility element here. Usually your slackers, it's not a complete surprise. So maybe what I'm hearing you say a little bit is maybe I should have proactively checked it. Maybe I couldn't trust that he's going to show up on Friday with everything done. Maybe I should have been checking with him on Wednesday just to ensure we didn't have any issues at the meeting. Wonderful feedback. What else? All good comments.
You had the same situation you asked him. 2 days in, and goes, "Look, you know me right? Yep, got it."
Ah.
Same discussion.
Now he's a liar on top of being a slacker. Okay, what else? Yes.
We talked about it kind of depends on who it is and how often they do it. I mean,
Okay,
somebody does it
certainly.
Annually, it would be, I would treat very differently than somebody that did it on a rare occasion.
Isn't it almost similar to parenting to a certain extent? You try to look at the situation and handle things on a case-by-case basis. This is the first time in 10 years they've ever, dropped the ball or been late versus do they have an excuse every week? It's the same thing over and over. Very important point. What else? Yes.
I say when you form the project in to begin with, you set some ground rules and you set your expectations. So such things, to avoid such things that somebody's letting you know last minute.
You've been reading ahead. We want to prevent it, and that's some of what we're going to talk about today, because I think it is multifactorial. I think we have a responsibility as a PM to try to set that environment, and that's what we're going to talk about with a culture of accountability, but clearly they have responsibility as well, so we don't want to abdicate or allow them to abdicate their responsibility. Other ideas? Yes?
So we're kind of moving with number 4, that, letting them know that it wasn't acceptable.
Ooh.
That,
We're afraid of him.
that
He said number 4.
we want to get the product, we want to put it back on them to get us the product, but then we want to also let them know, you should have let us know earlier, we should have repassed.
Okay. Number 4. And I've done this many, many, many times, so it's really interesting to see the numbers that people select, just out of curiosity. I've never really done this before, but just out of curiosity, he's saying number 4. I'm just wondering, how many of you feel like you would like to say number 4, but feel like you'd be more likely to say number 1 or number 2? And I would probably admit to that when I was a PM. I think that's what I felt. That's kind of a little bit of the internal struggle that was going on with me. Let me offer you one way to approach it. And again, I say this is not necessarily the panacea for every situation, but let me tell you what I started developing, and it relates a lot to what this young woman said back here about establishing ground rules, making sure the consequences are clear, all of those sorts of things. So I turn to him and I say, Luke, thank you so much for letting me know about that. I appreciate it. Which action item was that? Which number was that? Because again, I'm going to have a precedent of documenting these action items. Oh, that was number 37. Great. When we get to number 37 during our readout, please just give your update to the group. Now, what have I done with that response? I put it back on him. Because I promise you, if he's running up to me 5 minutes before the meeting's about to start, telling me he didn't do what he told me he was going to do 2 weeks ago, all he's doing, in essence, is attempting to transfer the accountability of that action item from him to me. And all I've done, because he wants me to go to the team and say, oh, Luke didn't get a chance to get it, but he said he's going to get it to us by Friday. So let's move to the next item. He wants me to do that, okay? All I'm doing is pushing it back to him and saying, hey, accountability, it's your item. It means you just give your update to the group. Now notice, did I condemn him and tell him he's horrible and you are going to hell and all that? You're going to burn in hell for not... I didn't do that, nor did I give him a pass, okay? Because who really needs to make that judgment? The team. And that's what I'm talking about when I say I want to build a culture of accountability within the team. Because the other issue is sometimes people will try to get into this tit for tat just with you, and it becomes really difficult because you almost feel like you're in a parent-child relationship. And I want to get away from that. I want people to feel that when they're on my team, if they say they're going to do something and take something, they're doing that not for me. It's not doing me a personal favor. They're doing that as a team member, and they're accepting that on behalf of the entire team. The other reason why I like that is teams I found do a wonderful job of that discernment that young man was saying back there in terms of, is this a one-time thing? Does this person do it all the time? And really deciding how hard should we come down on this person or not. Yes?
So you're going to have to deal with this outside the context of the meeting, because if I'm a slacker, I'm going to go, oops, I got to run back to the web fiasco. I just wanted to let you know this real quick for the meeting.
Ooh. I have to be honest, I don't think I've quite had that, but really it goes back to what she said before. This isn't going to be something I spring on them. This isn't going to be something they don't know about. We're going to establish a ground rule at the beginning of the team that anytime you accept responsibility for a task, it's your responsibility to always update the team and update the status. Okay? So it's not going to be a surprise. They're going to know. They're also going to know, and trust me, anybody who was on my teams knew this. The very first thing on my agenda item for all of my status meetings was review open action items. So everybody knows, first thing I'm going to do is pull out that spreadsheet and go down the list and say, number 17, who has that? What's the status? Number 18, who has that? What's the status? That in and of itself, just setting up that structure, I promise you, will diminish a lot of that slacking behavior. Because people know coming in, the first thing I'm going to do is ask you to update the team on your status. Okay? What do you think? Does that make sense? That's what and also I treat everybody fairly. Everybody fairly. Because what's the problem with number 1 and number 2? Because we feel that pull. That's kind of what we want to say, because we all can relate to that. But what's the downside? If we just kind of give them a pass and we say, oh, you know, it's okay, don't worry about it. Yes? Okay, now we may not have a firm date. Even if you do have a date, let's say he says, oh, I can get it to you, you know, in a week. And I say, oh, okay. What's the problem with that? It sets a precedent. Okay. Now, it sets a precedent not just with him, everybody else. Dr. Phil said a long time ago, you teach people how to treat you. Okay. And what I've started finding is if I'm a little too lenient at the beginning, next thing you know, I'm 6 months into the project, and then this one's got an issue, and this one's got a complaint, and this one says they're going to be 3 days late. And, well, you gave an excuse to this one, so why can't I have, you know, another 2 days? So I want to get out of that never-ending cycle. I want the team to decide how we're going to run the project. And I'm not saying crises don't come up, because they do, but you at least acknowledge, hey, this is what happened, I'm giving my update to the group, and then we as a team decide how we're going to move forward. Maybe we talk about the consequences, maybe we use this as a learning opportunity and we establish a ground rule, maybe we say in that moment, hey, guys, what are we going to do in the future? Because now, because of this, we're having to slip our schedule by another week. So what can we do? What ground rule can we put in place to ensure things like this don't happen in the future? And in my team, what we did was we said, hey, anytime you've got something and you realize you're not going to be able to meet that date, it's your responsibility to pick up the phone and get another team member engaged and to take that action item on your behalf. So it was a learning opportunity for us. Okay? One of the reasons why I really like this is I think it symbolizes the struggle and the pull that a lot of team leaders and executives and project managers feel when they're in these situations, because you want to be focused on task. I mean, we're project managers, aren't we? I mean, isn't that what we're supposed to do? We're supposed to have status, we're supposed to get the task done, make sure we check off everything on our checklist. But you also want to preserve relationship. I mean, don't you want to be amiable and flexible and willing to renegotiate and hearing people out? I sat in the presentation this morning, and one of the things that came across from that was the relationship is one of the most important skills, relationship building, that a project manager can have. So would you agree with that, that you feel that pull sometimes? You know, you want to do both. And so one of the things that I want you to think about is, where do you think you are on that task relationship continuum? Because most of us have a natural style. Just like most of you are usually left-handed or right-handed. One of you probably has a dominant preference, okay? So it doesn't mean you're a bad person. Like for me, I'm, probably a little bit more on the task side. You know those people who they only kind of remember your name when they need something? Or they only call you when they need something? People don't love those people. They really don't. Versus, those other people, that, they come talk to you like, oh my gosh, you look so great. Did you get your hair cut? Oh, it looks wonderful. And how's your daughter doing? Last time we talked, I know she'd had that bad ear infection. And, how did that work out? You know those people? I'm like amazed by those people. It's like I barely can remember what I had for lunch yesterday. It's like, how can you remember all these things about me? But those relationships, those are the people you want to just jump through hoops for, okay? Well, just, I wasn't one of those people. I was on more the task side. And I realized over time that wasn't working for me so well. So what I did realize was the most effective project managers were in the middle. I call them the thoroughbreds. The ones on the left, task focused, those are the bulls. The ones on the right, relationship focused, those are the lambs. They get walked over half the time. The ones that are the most effective, I call the thoroughbreds, the ones that are smack dab in the middle. So one of the things I've done over my career is try to figure out, how can I move more towards the center? Okay, how can I compensate for the fact that my natural inclination is, I don't care about your weekend, I don't care about your kid, I just want my stuff, okay? Because that's kind of what's going on in my head. I mean, I don't hate you or anything, but that's just not as natural for me, versus it's very, very natural for some other people, okay? So just as we talk, and in some of my training classes, if we were really in a training class, I'd have you put your dots up there to indicate where you were. I'm laughing because I just did a session for a technology company, and they were all task. I mean, they were so far over there. It was just amazing. But what's interesting about that is that will work for you for a certain amount of time if you're in the right environment. So, for example, if you're managing and everybody on your project's a little techno-weenie just like you, and you're all very task-focused, and you're like a pig in mud, because maybe they don't necessarily need some of that touchy-feely quite as much. But it won't work for you forever. It really, really won't. Also, what I've seen is as people ascend that hierarchical ladder, they go up and up and up, and now they're managing much, much larger groups. Those groups are not as homogenous, okay? So maybe before they had a small group of task people who just wanted the structure, but now we've got larger groups, and I've got relationship people in there. They want all that soft, touchy-feely stuff. They want me to come up to them and talk to them for 15 minutes before I ask for my stuff. And that might feel a little bit weird. And I'll just tell you one, again, I'm very focused on techniques. Let me just tell you one technique, just so you know how real this is for me. I was on a project at AT&T years ago, and there was this one woman on the project, and everybody knew they had to give me their stuff by Friday at 3 o'clock, okay? But there was always this one woman, and I just thought she's just Satan's cousin. I mean, that's just the way she is. It was just pulling teeth every week. It's like I'm going to have to escalate on this woman, like every Friday at 5 o'clock, I still don't have it. And so we just had just a really kind of contentious situation and relationship. And then at the end of that whole project was like, 8 months, they flew everybody to Atlanta. And so they sent us all, the project's over, and now we want to do the celebration. They sent us all out to Dave & Buster's and gave us little cards so we could play games and all that. And before that, they had like the lunch. And so at the luncheon, as luck would have it, they sat that woman right next to me at the luncheon. And we had just had this like contentious 8 months. And so I'm like, great. But now at this point, the project's over. So we don't have really, any project sort of stuff to talk about. I don't know how it happened. Somehow the subject of the young and the restless, okay, came up. And I had watched Young and the Restless for 20 years, and she had watched Young and the Restless for 20 years. We just started gabbing about, remember when Victor's first wife, Julia, and Nikki, and Jack, and all that. Literally, in about 10 minutes, we were like this, okay? And we were like laughing and saying to each other, wow, if we had just had this at the beginning of the project instead of at the end, it's not that it would have necessarily been a panacea for everything, but it would have changed how we looked at each other, how we reacted, how we responded to each other, because now it's like she wasn't Satan anymore, She was my friend because she liked the same stuff I liked. So sometimes it's amazing how little we need in terms of that icebreaker, in terms of that relationship building to just kind of get that started. And so that was very, very eye-opening for me early in my career. But ever since then, I really made a huge effort at the beginning of the project, not just to develop relationships with my team members, but also be sure they develop relationships with each other. Because the other issue is, how many of you been on teams where they've got like cliques? Yeah, I mean, you might have the Chicago clique and the technical clique and the smokers. They usually are a clique because they're all huddled outside, together. But whatever it is, sometimes that kind of bonds and brings people together. So it's so important when we're talking about these slackers is to use also techniques that balance a focus on task as well as focus on relationship. Because when we look at answers 4 or 3 and 4, or maybe even more harsh, what's the downside to being too harsh? He said no downside. Is there a downside? Let me rephrase the question. Oh, okay. Is there a downside? Do you think there's a downside? Yeah, what is it? Have you seen that where people become passive aggressive now? Oh, so that's how you want. Oh, okay, I'm gonna get you your stuff. But now, next thing you know, it's like you could be headed for a landmine and they're not gonna warn you. They become real passive aggressive. Exactly, twist it around. And I'm so glad you said that's another reason why I want to get away from this me versus you thing. Because sometimes, again, it can become real confrontational. And also, sometimes people can try to minimize you and say, oh, it's just, she's so anal. She's so, whatever. Versus the team responds. And then now, all of a sudden, it's not one person telling them they dropped the ball. It's 3 or 4 or 5 people kind of giving them that look. Like, well, you could have picked up the phone and, said something before now. Then they can't minimize everybody, okay? Or it's a lot harder to minimize everybody. So that's what I'm talking about when I talk about this culture of accountability. I want us to develop a culture. And if you don't think your team's got a culture, you just haven't thought about it. Your team has a culture. Any team that's been together for any period of time, you've got a culture. I want to develop a culture where following through is the norm. Have you seen teams where following through is the exception? And where we just kind of expect, sometimes I call it meeting deja vu. It's like we have a meeting, we talk about something. Oh, somebody said they were going to do that, but nobody really wrote anything down. We started talking about something else. Next thing you know, 2 meetings later, the same issue comes up. And they were like, well, didn't somebody say they were going to do something? Or didn't we talk about that last month? And it's just kind of in the ether somewhere, okay? Very common. So I want to develop a culture where, no, following through is the norm. That's what we expect. Because I promise you, people will change their behavior to match the culture. It happens every time. Their meetings, in terms of when they start, that can be part of your culture. Aren't there some meetings that you go to that they start on time? But then there are other meetings. How many? Raise your hand if you've got meetings that you know the meeting is not going to start on time. Okay? You could just predict that. Okay? And because you know that, then what do? You show up late. That's exactly what I'm talking about. I have a girlfriend. we used to meet for happy hour every Friday after work. And then she was notoriously late. I mean, I don't mean 5 minutes late. I mean 30 minutes late, 45 minutes late. It got to the point where I would not show up for at least 35 minutes after our scheduled time because I knew she wasn't going to be there, okay? And I didn't want to be there sitting there twiddling my thumbs. So that's what I mean. If you want to have a culture that says we start our meetings on time, you've got to do that from the very beginning, and you've got to insist on it. And what you shouldn't do is what I see a lot of people do. They try to be real lenient at the beginning because they're in that forming stage, and I'm trying to be nice, and I want people to like me and all of that. And so they start late for the first 5, 6, 7, 8 meetings, and then they're like, ooh, this isn't working. And first it was just 5 minutes late. Next thing you know, it's like all the meetings are starting 15 minutes late, and it's really costing the team some time. And then they try to clamp down. So basically what they did was they were too far on the relationship side, and then they tried to swing way back over to the task side. And then the team members are looking at them like, what is wrong with her? She's acting crazy. So if anything, be real clear about those ground rules, about the environment you want to have from the beginning. And it doesn't mean you're overly harsh or you're cracking the whip, because in most cases, I'm not going to be the one to develop those. I'm going to get those from the team. We're going to talk about that in a minute, just what you said about the ground rules. But I want peers to hold each other responsible. I'm not holding you responsible. You're not my child. I want to get out of that sort of relationship. I want us to hold each other accountable as a team. The focus is on producing results, and then team members pitch in, because we do realize maybe she did have a crisis that she had to run to. But I want us to have a culture where we're willing to pitch in for one another. I want it to be team-centric as opposed to PM versus the team, and having that tension there. Now, part of this, building this culture, is exactly what these guys back here were talking about in terms of the responsibility of the project manager. You want to set your team up for success, okay, and minimize the likelihood of slacking behavior. Part of that is appropriately assigning your action items. Number one, it must be written to be effective, okay? Can I have anybody testify that verbal action items don't work? Okay? You must write it down, and write it down in the moment. So let's say this is one of the items that comes up during the session. One person on the team is going to compile analysis of different vendor products, features, and distribute it to the team. Okay, that's the task. What is missing? When and who? Because I promise you, when people do not do their action item, there are two main excuses. Oh, I didn't know it was me. You were looking at her. I didn't know I was supposed to do it. Yeah. Oh, he said, I thought you meant next month, or I got too busy. I had too much work to do. I mean, how many of you wish you had $1 for every time you heard that? So I want to eliminate each of those excuses. So after I write out the action item, and if you're on a conference call, what I do is identify somebody on the call who's going to be the scribe, and I always repeat the action items for the scribe, and I ensure that they have it written down. So after I do that, I write out the person's name. Okay, and what's your name? Okay, so Sandra. So I'm going to write out Sandra's name, and I'm going to put a box around it, okay? And then the second part is really important. I need eye contact with her. I always say, okay, I need you to look into those little beady eyes, okay? And you want to ask the magic question, when do you think you could get that done by? And then you wait for her to give you a date. That's powerful. I promise you, if you haven't done it this way, it's very powerful. So let's say she gives me a date of May 20th. So I write down May 20th. Now, why am I making such a big deal about that? I mean, what's the difference between me asking her, looking at her, and asking her to give me the date versus I'm the project manager, I know when I need stuff, versus me proposing a date and just saying, hey, is that fine? Hey, can we say May 20th? What's the difference?